manje muligirira ya Etaya TV na indi chigati chiri chekire to the wedding ali chikole di matano butambe to chitokwa na magana alengete chisemi kulinde nje uno waziri baba chenu asomuro lugweta breakfast show to wadebana no way we gana ende to kwa na magana alengete baba chenu ekiagara lende no somu ko rualeti to konyare to ende school osto nyara kwa kende kero gwete bobe. That is why no yana celebrate data simambia bona to abolianga ine ekero moko wala nenchi mitiko kambo ekero moko wo sinya gitare malio gachire ngiko nyona abantu abangi batari ko batayare kwenda nyagitare uchikulengwa abantu mwato wa so many reasons which no chisomera wa nyagitare by the way abantu mbaweta kwenda bakolwe bipimo mbali mbali asichinya gitare, and for that reason wanchu muligereria there is a medical camp and a mono ekwenda na litikolia angyo. That is why I have experts process mo yobo chenu bawo osangana intwe asemambia bono igorero to mozoto besa kosu kakwase Etaya TV ekiagera abagende baitu muno chabo ase TV yao igobari mari dadi anditele abagende ba kawaida osubabo tambe na abagende babata experience and knowledge ese mwana lenge to bochenu abange baino ombera nenda barabo ase health facility kende mboba banyete kende kuarora more bono ase libwa kabisa gochibara ko introduce burunge kigima to bamanyanga mara bitole barakugega ase studio nekirenga kyabala tangega ase studio nenjera yamoyo ko give back to the community na botelia abantu barakibamba bawena te komenya bya kyabonchenu ekyagala barabo umiranire n'abantu babwate hali mbali cyamangana yemechando y'amarwere. That's why they are here nganto ganya tugenda nyagitari kurende kanya gitari ya mwire wo cyane nasemore na inumo bwatensemero n'abananchi ngasemambia bono na watu kuligeria igoro ya mangana y'abachenu. Karibu sana asensema ya online producer ne watenga na watu Facebook ni watu live right now Etaya TV, YouTube tuko live right now Etaya TV, SMS line twanyigolire kabisa 0735 333-000 tocho kwana igoro yobuja woko nyorobo gwenya igoro yobuja woko yenda sichimiti ko kambo ekaro chia chire igoro yobuja woko koleba screening kumanyekana maroiro kwata somobere ebito binde binge ndati nkwane mono manje mongereria nganjire asenjere abene. We introduce our guest as student semambia bono batata ibarumba rabi egera tumenye guchaka omurubule. Karibu sana Etaya TV boborabu wabusi to what the ladies cigar guests, but what the gentlemen. And I want to take a chinkari over Mambia. You don't want to miss a discussion in Mambia. The other chakra my far left.
Mbiamono ase Marieta ni ngongoro Dr. Donald Rate Mongechi. Onde mune clinical pharmacist, that is a consultant pharmacist at Kisi Teaching and Referral Hospital. Na inde deputy county pharmacist Kisi County. So lero twataka tukwanira mangi igoro yechi medical camp. These are free medical camps. What we offer, what services will be offered asa wananchi na obuya wogo chasa chi medical camp yechi tari rasi mobe no muruire ese no ruarete abakonya nderi bagali wogo china ndurigere ligubiya Biamono.
Karibu sana Daktari Donald. Karibu sana Daktari.
Biamono. Marieta goro Dr. Raymond Oigara. Sito Wanchari. I'm a consultant surgeon, yani consultant samgana yuko bara. And endoscopist yuko gireri ime jinda chama to ime goro go sichar sanchiro ande mintagete. And Alimunde University. Nerete Ogosomia Wanyagitari Kisi University. Yani I'm the dean of the School of Health Science, Kisi University. You co-host a medical camp ya Angjo.
All right. That's a very brief and decent introduction. What you can agree with me. One of the type of people who are the right people. Dr. Donald, Dr. Raymond Oigara. I think you've met them as Chinse Mokada. Dr. Oigara, what is an endoscopist?
Endoscopist.
What does that even mean?
Endoscopist, Garomo, the Amaruera Yenda.
Yes.
Abantu bakutabendu alianda. Ose koroka manyinga. So kwenda maybe aja wata manyinga aja nene. Na mondo takomanya kwa so korigere bosaigo so tamanya kitari so kubata. Weka akumureke abeke ngende kujimonu. Kagende paka na kimureke kerase.
Wow.
Kimureke mara onsi kimamene dio tendiro na kiorwalete. Na alisa bosaigo. Na kansa bose chigas bosaigo. Elino to amanya. Gama na wana wanda wange bakurwali kuna alisa na demba bwati alisa. Ono wacho toma mureka ga tonya ratari alisa. Tonya abandi konya kansa bagwate warwali ku alisa no ene myaka ebere. Iko na ndiko chimbia kwa boli. Ekero montaro kwa warwali ku alisa. Matukana yani amatuka mangi. Kwa deriko bwena enjuwa molekwe kwa endoscopy tonya kwa tabu na ekiti yiteri original gando ko original na lyo bwena ukento ke obneki amalioga na boko bwena onya ne chialsa challenge
igwa montoro moyo obikirwa a certain equipment
gochimono iga kwa kali gukora iga gusensia obekero gochimono egento ke bwate camera netaya ya tuwa molekya so gochimono gochinda tumbatoligere TV ga enda bunere ga moyo goko merendagera amara ebon nere kwa endoscopy.
Is it very painful?
Very painful. Kwa goko rara go karatori ga bosonko manoma rise galaxy storm to cover.
All right.
Ebon.
Wow, that's very nice. Daktari Donald, I want to mangana a pharmacy.
Mariogo
Ndo kwa machiko, watu Mariogo. Wenje ningaloje na igumbe, ndio hata sijamaliza hiyo dose. I felt like I'm okay. Ngatigari, mbobe.
Abumbobe kabisa.
Alright.
Be straightforward. Kera kwa iro lyogo liria, nore gwatebi kuna matuko 5 kunywa.
Yeah.
Onyu litko litangani onyu litko lya kabere ukwabere buya otige ana mawaso.
Okay, that.
So go bwati dosi ilikuwa ya 5 days. Okore.
Okay.
So you know when we are treating either bacteria say viral. Amarioga yoko we duration yoko make sure ya kilire ni nilionsi kuromobere.
All right.
So the moment you stop taking one wasalirie dosage iliko correct clean up the body, so you might again become sick.
All right.
Nega tukende we encourage abantu kere bakunywa marioga aria otema kunywa amache amangi.
Sio soda, sio chai.
We really discourage kunywa soda amabere. Maybe erongori it's okay, but we emphasize purely want to tumia maji.
All right. For that reason, I'll bring you on board next time for what the do's and the don'ts. Because daktari wigara kama uligonja oranga no bwate mchangitenda atakuandikia dawa. Tutarudi kwako. Tupatie dawa. But the most difficult part no kunyomolela yokwenda. So we will call you some other time to kuandikia. But for today, Naro Chenga Kisi University free medical camp. Daktari Wigara asendo chimoja wakora mangana manga mangi. Let us begin from there, Daktari Wigara. What is this? What is the motivation behind your action for the medical outreaches program like this one?
Miyamono Sara.
Yes.
Medical camp gato jaga na kwere sawa na inje medical camp medical camp no sangere kana ya bantu so magocha korwali kubosa gere free okorwali ku oyo rwalete oyo tarwalete oyo advice no yo tarwalete na bago pima manwera tamaiti ko sana bwate iko kuna screening screening nero ya cancer screening nero ya marwere ao na bora maitoro durwa abaga una prostate cancer abasoma na breast cancer cervix cancer ya cervix iko tokarora na the university yaito dowate school of health science umwako ko graduate wana for the first time wa ko medicine dowate wa ko nursing dowate wa ko pharmacy dowate wa ko public health dowate wa ko medical lab and the vice chancellor ito now declare na health the niche of the university, especially cancer. Kwa tukarana tika tu warana into medical camp tuwari abantu baito bosa and then to abantu bamanyana to bwate abanyagitari university and ko samtara abanyagitari to bwate consultant designer Because the government to watch about where you medical camp ina mengi nero medical camp is free buneya nero ya surgical camp yuko bara tu nero jiro just screening was ego jeta ko ruari lakini wana ego ko ruari mario na togete naro na bantu ko so me gobare SME health education na screening aboko bara na uto ko book to ma go ko surgical camp baadaye.
Okay. All right. Yeah. So ikirenge no services, free services.
Free services.
Chico to Itaya, but Muchire, Kate,
Dojo university grounds, Aristocrat graduation, pavilion.
Okay, Daktari Ratemo. Daktari Gara Besema from Kisi University, and is the biggest stakeholder. Alright, I want to know you're a big stakeholder from Ketarech and from the Ministry of Health. What brought you together?
A medical camp in collaboration with the Kisi University na into tokoroka Inca Medics.
Okay. Inca
Medics.
Okay.
Inca aba n'abanyagitari bonse pi abagusi giving back to the community. So in this medical camp etoko encourage kero montage. Kera abanyagitari mbakaro abanyagitari they are willing. You know the best thing Sarah maybe utanya kumanya.
Yes.
What the community sometimes figures out is doctors are not friendly, are not social, but we are the best social people. We are the best social people. So we are bringing in this medical camp to the community for free. For free.
Like free,
yani yeye mtujoko ko make sure we kire area. Yeah. So we are giving this medical camp for free.
Okay.
Including bagocha bachekiwe aba ruira bange babiri maybe bakobolinga yito kaina kika anda igundore doctor igara na kinda nyore doctor ngeji na kinda nyore doctor matiko na kinda nyore doctor imeke. Now these doctors will be available for free. So na bara ikegate unabona yaya kintetikoro imeke ndetendore oigara tetendore ngeri tetendore abanyagitari bakaro abange. So it's a free service to our community. In general, na bali in our community. So what we encourage abantu bacha subungi. We are ready, we'll serve them to encourage medical camp chichinyinge within Kisiga. So to arore na chigo koreki chigo konya bantu baito.
Yes.
Amariogo na karo. Tima teseri swali ndiche lakini umonto nambo leti. How moko ensure marioga ya moko for donation are up to the standard.
We will reach there.
Thank you.
Reach there and we'll go to Kapisa. Of course, we can't do without that question.
Yes, be mentor. I go county. Elindo hold the medical camp. We can only permission the county director of health. You go county director of health and at the permission. Get in the county and kiss you. Go to Guardia and the Wakis. We can say the cardi money. So, but the ribaga and the abanyagitari we county baro na kwaiwa korujagitari tenena manage sub county and ikwaigu na Inca Medical Association abanyagitari barwete gusigo senyamira ko Kenya ngima and the water association yaito ya almost 300-400 doctors iko baro bagocha all over around 30-40 igabanyagitari baro baisaini ngoza abananchi bacha kwa wingi
Ndio mwana daktari Igara daktari Ratemo. Daktari Igara, this is a good cause, all of you. This is a very good cause. Inga you're giving back to the society. Bantuba buganga kwanda galaxy daktari Igara mono lejiweza lakini people stay back at home. But mono ekambo yega, how are we showing bantu banyo this information to make them aware so that they come tomorrow. With all the stocks of medications, all the experts, then there is no people. How are you making sure? This is one way, of course, watching TV, which is very good. But now, how are you making sure now from that exercise?
Biamona sori swali mbia kwa woni rende brana ogotangasira abantu kikira nekinge cyo gutangasa Etaya TV ne wate audience nene abantu already bamanyire abantu batangasira twese kikanisa kibrocha ngoenda kire round na rero bosongoga wanafunzi wetu ngweta bale ne bana korokina medical camp ne rankyo igo ne rero ndo bwate na social media erekerase igo abantu sokumanya bamanyire na ndigabali batari baketiga jabarwari utarwari atakora do screening testing abande health education yogera montage kwa wingi rinde bakonyeke ankyo mama
Daktari Ratemo abantu nabara mwini event yiga ire ko Kisi County Ondolaro Kalanyamira ari makuru tumakwawa ofile tiga was part of this event Mbatu tumokwalao waje for this free medical camp in Kisi County abantu bani from other counties and they access this usebe no new Kisi County na medics
amaina nalia we treat everyone who comes in. So a medical camp, like there's a power of social media.
Yes.
So even people from the US, people from Canada, I think with them a medical camp so we allow everybody. We will allow it's a free medical camp. And for us, it's a universal thing. So when anybody comes there, we'll serve with passion and love.
So welcome.
Kila mtu wako welcome. Kila mtu wako welcome. We even welcome dignitaries, our MP, take this opportunity with their people around. Anybody, because the county governor, the county government, with the governor, but with the permission, nana key to give back to our community. So we are ready to serve everybody. Yes.
All right. Daktari Oigara, what you will get yapping engage Dr. Oigara to Kuiba, I know Madame Roslyn Oigara, to get Sana Simabiabono, now Italia Bani of Daktari Emma. You talk to Mecca, I know is following. A Jagara Musani Media Sarasana, Coramoleta, Matura, Gamba, Amana Yobochenu, Navana, Antobos, Kurimira County, Valibara, by Yagitari, Navalanji. You are the biggest free medical camp. Here, Corona Kisi University, what are the income medics, what are the county government ya Kisi, but in Keta Rich, a camp where you begin a singing to Yao. They're okay. Speak about like they have decided in Ayaya, oh, your way, and the way to what made them anyway. And honestly, now this is the right time. Mochi as a medical camp. When you want anybody about the medical camp, you are free to ask your question. What did you do? You want any condition right now? You want to what experts in the studio? You want to see the chinke. When you're a Dr. Igara, when you're a Dr. Donald, you know what you have to do. Now, or what? Dr. Valentina ne benefit. And I got to what to go to Facebook to be Jumbeako, the summer, when you're Bayako, in any body out, Tawaliza, when you're Bayako, and you have to school your Ascenja, April, Gekima. Daktari. Oigara, asa medical camp yega mawokora watabango kolingol more naroje chronic diseases na prostate cancer na whatever abantu bane baro oranyoleta tamwaleti but nata itogocha gukora screening egera emanyekane egora lese posta naroje it's cancers prostate cancer, cervical cancer, prostate cancer and other chronic diseases and tomorrow bara then I don't have this condition then I'm not fit to go for this medical camp.
Biamano Sara,
yes.
Kendo kwanza nda hotevi mono turi kumanya gose no ruarite again the blood pressure mono turi kumanya gose no what hypertension there are no symptoms igo go chago pimo pressure yoka no nyane sukari bantu tari kumanya kare sukari go chaka abantu upimo wale sukari bosa ankyo pressure go chago pimo bosa ankyo abantu basome go maana ya afya muna wako menya buya nutrition counseling na counseling igore ya public health yoka gesa no kwerenda chindagera no koli aduna nate abantu baro bako beranga batamaje sembarwete gaga yocho olingori no yakore buyote buna MBO ina ere kuna screening and kuna corporate social responsibility yani university na county university erure kurwali abantu nicho kurwali abananchi gane kora baro bago chaleito ko bachibesa chibone so ankyo ina opportunity yo kurwali kubosa ago chera rukabisa poko burwiri wagandare ebesa ene bolet insurance yuna chacha kwa una chire oseiga outpatient yabantu bagwa kana cash sha inpatient bagwa kana garore ward aro there's no problem igo tigare ankyo manto bacha wari kubosa bachinte wari igo ekene opportunity nene from this university
Daktari natemu chanda sole Daktari is this the first medical camp in collaboration na wata ni abaina MNCP as a Kisi University ose Mwara College ananyo Mwara Chi College how is this one going to be different aso chama mayaba ndukucha
this is the first big one to accord in collaboration na Nyagitari baito wa Kisi County na Inka Medical Association and other partners. By their partners na bango to wate medical sango katore stoko mention. Yes. Partners baro.
Yes.
This is the first big one. Others we have been having small camps in Chiro na one of our nursing students but what they have our screening medical lab students but what they have on Kengego in the past association chinda again this is the first big one in Kisi University.
Okay, that's very okay. Daktari Ratemu, this is the very first big one. But this is the biggest as well of experts from all around the health officers. How are you going to make sure that the mambia amasomo nakao Rwanda ikabasomo kwanza alimo ngoje kana baganda cyari pimo modalo atakata pimo alingata ita masomo daktari yigano mention doing HLB education asamara yocheno but bono I'm wondering modalo achimambia tokera bate condition so how will you make sure that out of this medical camp mondo igana to continuous treatment together na mora when mo identifying problem now itagete continuous treatment no mondo iga na kimugo chikumba kishona you are following up as a result of the medical camp yotari atine ita mwamanyire na kwata very chronic condition itagete continuous treatment how are you going to make sure you are following up with the patient make sure he's on the right medication appointments and the clinics to make sure that utaramolere nisabali because ekine kige ntakende mu medical camp liga
Thank you.
Yes.
Ekeroche we came medical camp really. We have structures. Structures in the sense that na wasokuru ali murango ngobekura se tokoroke triage.
Yes.
Currency where we can have maybe part of education as you wait for the process. Also say wandopimu sukari pressure kurwali omanye bono munya itari kyo chikora. Am I going to see a surgeon? Am I going to see a physician? So there's structures how the movement will be and how every process will end up. In case you come the first time, God forbid, maybe you have prostate cancer or you have breast cancer, all that, and we have identified that problem. We have liaised now there's a lot of stakeholders. If this case comes in, like now Daktari, for the surgical case, he might refer them to KTRH or any other facility within the Kisi County. So they'll have their follow-up, followed up. Like for instance at KTRH, a clinic kyabagaka, which is done once a month and on Sundays. Utatemuno busy esenini. So these wazes abangina nabagaka bocha bale baikaransiwa abanyagitari mbarali babasomi babakora ibisayisi bibere bitatu igabona babwene gukora babanyonye cyaye banywa which is a beautiful thing that has been initiated at KTRH. So in our medical camp, which is the biggest, the beer flow. So ntote tiba na inchi bache kobo amnana ki ntogo ikera ntoko ruwali ntoko koraki neka bangire chi emanchiro wada nebembe, we are set for the day. Yes.
Adikina mente se follow up yo kwa bole na kidogo jakora follow up kwa igule rifaro nero ande buno murera go sagari atara pimwa details chumure kero murera ngo ligari details ya paka namba jitsimi igo even the bios go jibere ko enter into data bank kurwo aba oyo rwa te mano na magwa ke simi onyo tara gende sabo ene to genda ndorgo chikotigara yo. We shall do book them special clinics in the county. We say follow up now in the so the process has been enhanced and it will happen.
And again, maybe a Canada, we are encouraging, which is the best thing we've been doing, that our patients watu wale insurance ya SHA. So you know now, like now it's free registration ya SHA. Kwa manya kubangana kio koraki how you pay. So we really encourage, and the SHA team probably will be there so that we register the patients. You know, bandu bakobwa yenteke giachitege serikali chibese gitogete gotoura nini. No, there's a lot of information they are lacking and misinformation. So we will be there. We will be there to tell them the importance of an insurance. Uriri na bora ruwaribo tuko tabu atibesa. Togote abono tiganganye mpaka next week ngoje kwenye atibesa. Apana. So we will also encourage them to come up. Not necessarily you're sick. You can come up, register with SHA, ask them questions, and then tumanye na kitoko koreki toko kwenye.
You deserve to have there. Asa mangana SHA morango because as we speak, our viewers into a holy ganga, balinga mwili gitrumo yo SHA. When they tell you that what they can't really. And to bagateva. They really said mimi sitaki kuregister kwa sababu nimesikia fulani amesema haifanyi. Mimi sitaki kuregister, hiyo ni scam. People mbara yegedanga we are with the SHA. That is what we are with. No one is going to the NHIF. It is SHA. Ona wewe smart evidenga registration nekaro tafadhali pia but and you make sure.
Yes.
I was wondering, we will encounter a lot of crowd. I don't know how you making sure that the neighbor or get killed isolated. What the neighbor can get some war. But I can take one or what I get when I children get tired. So they get yache manya. So how you make sure that kila mtu totoka pale akiwa anatosheka kwamba utasini tuko
biamono Sara.
Yes.
Ndengo iro mangana SHA tiga bantu baregister SHA ngo korerega sininche ngo bara maida na SHA ngo konyere sana. Ego alafu ego ya crowd ankiwa abantu tiga bachi kwa wingi. Ndowa tumpangilio there will be crowd control. From there flow never angire kuro amali organize in abantu friends and all these partners abantu donate ya maliogo here is a free camp. We also look for donors amali organize in kera ndekana no kurwali abantu iko amali onaro digabanda abachi barwali onya security ne kabangire flow ne kabangire crowd control ne kabangire.
Perhaps tell us Dr. Lugara, he functionally answers agapi remondo iredi amanye to start this time register so they want to bache mapema muigalali early enough abantu banye mucha saa 6 mu 6 saa 8 it will be of no use. Atobanye nake procedure kale ali antubakolwa ndaboro.
Function ego chaka kuru sambiri twaigoere vita. Wago ali geita main gate ya university. Waja ali se graduation ko baera. No sambiri baisa kuna moja usesa abantu bakwerera. Tiga abantu baje mapema ubuya abantu baitu kuna gusiga mba metiko boka. Abantu bakoro transmara na bono bagoboka mapema mono okunyara baikire clinic sambiri. Igori nyamira bose. Abantu moetiko tiga baboke bacha tukere mbagenda mugondo bacha barwari elinde to barwari.
Okay. Yeah, sana. Daktari Ratimu. Now give us the services. Chuchokwenda mbali na chichira se posta totebinga mapya igotokuligeri A to Z. Diseases igotokuligeri A to Z to hadigali ara se posta.
There are a lot of services, Sarah. Yes. A lot of services. Now, if Dr. Igara can also say, it's maruira awao. Abo choka ke bono inchuru wana pressure ngo pe pressure mbwata uirane otebutu bwati pressure.
Yes.
What you have is a mental health problem.
Yes.
Stress and all that. So ntobwate na kitote bantu ka bwata banyagitari wa kila aina. Bako munyagitari yo nutrition naro. In case somebody differs, your weight is overweight or underweight or lean, you need to check. So again, the privilege will be there.
Yes.
That either the other doctors who are there, the other consultants who are there,
yes,
now they can be having a lot of consultation. It's a surgical case, but also needs a consultant. Consultant. So the doctors there will have a privilege. Sarah can see and also can tell him or her to come back to me again.
Yes,
so nutrition. So nutrition team will be there, yes, pharmacy team will be there, a lot of consultation will be there. We also have our psychiatrist, mental team will be there.
Yes.
Then we have a dental team will be there. The lab team will be there. We'll have, it's a multi-disciplinary team. So, doctor, you got a surgical team.
Yes.
One day, team when it cover, Gabono again, and send doctor, getting send doctor, make a sematico, they have that opportunity. You go correct. You go pass from one section to another section. A team you do a lab nekaro, which way we'll have various lab tests. And I hope our lab team can have a department for blood donation.
Yes, yes.
You know, we also need to give back to the community again. In Tevan to go to Tobaruario, Canabora, the students will also be there.
Blood donation, Necaro.
Okay.
Blood donation, blood transfusion,
yes.
Otherwise, we go to Maruereki, Tokorwari Avana Macano, no, you're 1 day old, Pakavan in Avagot. Don't get on to pediatricians, Kilam is there. Amaruere screening Amaruere Maiso, no KCI, no Vakari, partners, Amayo, no Vakari, Amaruere Kuba, Ian Tinoere, Kuba, and Avantara, the gene that Chialsa, what was Chialsa. Screen my bonnet, the government of the woman. Very senior.
That is big, whatever. I can attest to what you will again. You've never seen it anywhere. Because you know, these are the people who see us. Okay, what they will specifically and what the doctor will die. This condition. Specifically and only doctor will die. Specifically and only. They will be there in one basket kubashughulikia. Andika tukia chini mwashughulikia ndo osielia. Bada daktari bada osielia na igono mbaga benefit ti mono tuto we're just justifying what they're doing. No, washughulikia other things. Na ande people involved over chenu wao. You should not take that for granted. Just go pimwa. Ngantile daktari toa soma some of the feedbacks. What we just in Biabono, we tell us in Facebook, and then when they YouTube, and then go to SMS number Naba, Kiagarando Chavantaka Ramagana, and they ask a lot of questions. And Lord Rat walking, Lord Rat engage, but we need to answer them because they don't know. That's why you are here. Also, Rosu, I'll Berenga, or you also I get a candidate is also Gina Yakishabi, out another way to go to Nakuru City, Salams Club, Asante Sana. Yamoya Clinton, I was watching live from Sengiri. But some help comes, are very good, I support them. But some are just scammers. Jukuna wenye niliona somewhere na ni hospitali tunajua vizuri wanapatia wamama wa kijiji mzima specs za kusoma ambazo sio sahihi. I think alikuwa yako ripete. There are some camps nchile chingia na very genuine ne chinechiloro for scamming. Ngakimogo mwana because there na roje camp ndeiga ekala kwa bangira bonsipi ebirole. Ngana yomwache camp not everyone should receive ebirole. But they have a very teaching man. How can you answer him?
Okay, onye medical camp jine chikawato bakora.
Yes.
Daktari mbali trend kutoa kwa bakora. That is over makora morwele la rasko kurwara mano usasire. Lakini esevi asara maybe even to never all think kumanya. Usamante wa kwa gobira le batapimiri. Abutin kumanya kabisa lakini yera begente ke besano nyeke karo. Lakini ese ntuga I think ro montana maite innovation center kisi ayo eliera ali nyanchwa. Nere kali tenda mwana maiso. They are partners with us and but they are professional. They are headed by Professor Kiage and they do their work very well. They go Kisi the county referral, they were the consultant here, myself, Dr. Clarice, and the services are above board.
All right.
You go ese kan me ya bata banka banyakitari yange bintu nebiyo okono kwero twero. Yeah, there's no direct benefit sabanyakitari kutatika korwali aba give back to society. Abanyakitari abananchi na wari with the tax in the tukasoma.
All right. That's okay. You can ask something to
yes. First, I conquer na daktari and I apologize if that incident happened.
Yeah.
But again, we are offering these services for free. And our part of services is integrity. Yaito. Toba totini na igeti bimuma ochokwe una twenkwana na ibirore bibe twenkwana na isena marioga mabe. These services we were not kind to people. No. Because after we sit down and we have agreed to give these services for free, we want to do our best. Nyasaya tutangane tusabwa wananchi na omulembe metakiri. Yama.
Nifote mauza bulito takiri. Itakiri what's the time? Bulito takiri because you have good hearts to let people back to society.
We are going for them.
Sitting at the hospital and wait for them.
Yeah, yes.
Kendi Sophie Motangi abatanara malaiti kwa conjunction. Morning ni John Amoma Amawaka at Nyangena Hospital. Watching you live from home. Nyangena Hospital's TVs are on. Watching you live. Say hi to my senior consultant, mentor, dad, Dr. Igara, live long dog. John Amoma. They are on. Nyangena Hospital, how are you? Thank you so much. Esther, last drop. Hata medical camps zingine they are scammers. Hospitali inaleta camp kwa kijiji, unakam ku complain like signs za UTI. They tell you need further investigations. Wanakupeleka inpatient like 3-5 days ndio wapate pesa ya SHA. Some of them aziko genuine. But let me now remake the report ya kuna minute kusudi na understand. Daktari mambia mulwire nache aseka. Then when your condition yaye telikoera raga ase medical camp. Not get further investigations. Ono Esther getting mujamambi akoda nimota UTI igata to mama yogo there aendeka anyuma yoga yogwen. Tatage tipo mota further investigation. What are some of the conditions chiragere mota yumonta out of the medical camp mambia ingana tokwa you still need to come to further investigation. What are some of the conditions chiragere mokore?
Ndia mono Sara ditangani tiga na understand ki is community scamming erona nyagitari njiro chikwanda gento ko na marketing market chikwanda ko market kina karore sana the private hospitals go and the medical camps with ya chikori ya barwaire in quotes and ko market which is okay lakini mbara of course bara takiko abeke ward elinde wanyawale chibesa ko ruesha
so she's right
so it happens it's not a good thing but it happens lakini ya ankyo it is a public medical camp by the university where the hospital go weka abantu we are and especially to the government hospital
so there is nothing wrong you telling you mondonga you need further
with the open arts, there's nobody marketing anything or marketing a certain hospital. Just to offer services. You want to go about in a Maruera admission. What end some Aramin night. Chihani age. Even the Takere surgery. We will refer them. Another way the refer forms and the body is attacked the Kogan. The Ritual and then okay. So that the program done tomorrow. They will know what they got. Sincere, sincere. That is not was a marketing.
Right. So at some point you're saying in America still you observe a patient's rights.
Very important.
You have something?
Yes. You know, a patient can be referred to an hospital, maybe on what the doctors have seen the conditions. Like you know what the UTI were referred to hospital.
3-5 days.
3-5 days. There were maybe checkups.
Yes.
So we wish we could have known how the end mat was, but because aliambiwa aende hospitali angaliwa pimwe, we really don't advocate somebody to be admitted if it's something that should have been done and a home. But again, there is a referrals. Could you upate mtu maybe the patient has pressure or has a minor thing that need to be checked again. You can be medicated for maybe 5 days, then when you referred, come back again. So if the incidence that there is no change, we can also able to admit you, then do more checkups and see. So sometimes we require them to be patient. Nobody is a scammer anything that comes in, but your health is very important to us. It's very important to us. So kindly be patient. The issue of insurances, there is insurance with our own for teachers, which now like in our public hospitals sometimes you may not be admitted. Tatuma wende please. So let them not scam that Dr. Atem, Mama Dr. Gara or Tomire Breeze clinic kia. Yes, your medical health provider, like teachers. Now they have to go to Breeze. From Breeze, wanakuwa referred either to Oasis, to any other facilities within the county, patient preferences. So let them know that again the insurance will dictate where you're going. Yes.
We get you. So Baba Esther last drop. The time we go to buy reselling Talma Mocho, Waikima we don't know what the condition is that when there are Gilima. Now Babu will refer to other medical facilities for further examination. One of you are working on again. I'm being referred to another healthy facility. Jonah Momo, I must attend this camp. So educative. Thank you so much, Mandia. TV. Now I'm here. Thank you so much, Bahrain Kingdom. Roslyn, Yakona, David, how are you, madam? How are you doing? Good one. You are sweetheart. Roslyn, Yakona, David. Thank you so much. Well done, Sarah. Thank you. Esther, last row, watching from the common primary, audio. And I am a qualified RCO.
Registered clinical officer.
Oh, registered clinical officer. Naomba kazi hiyo ya camp tushughulikie wa Kenya. I'll be proud one.
Amekaribishwa akuje.
Ambe, she's most welcome.
Esther, the last job. You're most welcome. Daktari wewe tena daktari atimo. Andrew Matunda kwa Nyamira town out there walime. Ongera Justin kwa enchoro ya kusamara watching live. Dennis Okioma, I'm ready to volunteer. Thank you so much Dennis Okioma. Just volunteer and do the services uchesa bantu baido. Brano Nchuru atavire natole tukolechizo mche korongo nyalibali masaba logged in. Abomba limoto kwa tete wotera sensemo ya Facebook. Ngantene daktari Nasema ya YouTube tunaramba ribato ligeratie mtu basikerera isiko kiagera a lot of people are following us through online platforms asemambia. But before that tigana enda say SMS oyako kwa hello watching you right away. I'm Cynthia from Mosocho, was diagnosed with the disease called GERD, G-E-R-D, right? I have been under medication for long, but this pain is still there. Will I go for OGD again?
GERD, gastroesophageal reflux disease, yo abantu wale wabate kiongoleka.
Yes.
Onera depending na pain ya wate ne kiongoleka pain kia minute ko ne pain yenda ikiara GERD te ko se pain yenda ne kiongoleka korenta kuna bora nyore GERD yo ya na wanyako ya roreka te endoscopy lakini ndari ya korenta pain so again ja wente gocha na wona na wente gocha ma ankyo atorore.
Right.
Pain you may not be related to GERD. GERD ne condition may be ya roreka te endoscopy. Na wora tore GERD to eguri ogoterigo ogoteritara enta mechande somovere so pain ina vera bene ngente kyao so mbiaje atari endoscopy ya jaro ro munyagitari.
Okay, thank you so much Baba Cynthia kwa Mosocho. I think daktari yotebringa kuja kesho uangaliwe kwanza wanadamanye kubwatia asema ya YouTube nindoche abangi modulate kwa YouTube kunita TV na ndeka wikiralia genda subscribe gali wende daktari lazima hapa ni juice pia mimi so ukifika pale YouTube subscribe weka notification and what the breakfast show ya chati na sala nyaragitisha na Brighton Makori imulinde Etaya TV engere one of our members as Etaya TV. Ako kwa Helen Moturi, I want to have a good work there. Salimia Daktari Oigara. I will share this information to our mothers wakuje wasaidiwe. Please do, Heleni, be the ambassador asili tukiritikali kongwa nkemambia kili ajire na nito kumanya how long it will take for it to come. Ige opportunity kia ajire, just take advantage of it. Mochi muligeriwe amangana manyekoba urungi. Ase balimwe ndatuko tobwate ina mbeyu yuni wate WhatsApp. Nidoche bandi batolike WhatsApp akora kera ni Dennis Corona Kuru City watavira nwalima watainga kwani daktari Wigara kwani daktari Latemo. They are very nice people. They are really giving us very nice piece of advice. Thank you very much. Asimambia bono divira mora nadolwetu kwa South Mogirango ara se skuru ya Esaka Primary, agote bikwanya bagani baita studio. This is a very nice sensitization. Abantu baitu banyoro bwenia. Thank you so much, madam. Aso tulikira ejumbe yao ase emambi ya bono. Amwansi bali mwenda polika abantu bwenda tulikira mja kabisa kutana hiyo medical camp kuna orthopedics. Will they do surgery ya orthopedics? Please inform me. Njue gaki. Lakini mwaso wakora ungetuambia jina lako nasi orthopedic but aizuru daktari gala daktari Ratemo. Will the orthopedic department be there and will they perform surgery there on the ground?
Surgical disciplines once overkade orthopedics eminenti o surgery ya mauga surgery awandu baro na surgery general surgeons. What we have tomorrow is purely finding out like what a surgical condition. I think we are planning a surgical camp, purely surgical camp. I think some months ago, I was last year to about the orthopedic camp na KTRH, America. So we are planning another camp this year, surgical. And then beyond I think before the end of the year, nonya cardiac surgery ngojero kwa rugusiga open heart surgery abasongo moja barega fosa. So depending on that, we want to plan another camp for surgery. A year of my we care even a weekend. Surgery over several days in one day. So that's a plan for the near future. Now I go referred immediately for an immediate problem. The surgeons will be available for advice.
Yes, no. Thank you, sir.
Yes.
What I mean, for what he has explained, clearly, like, we have plans for our people. We went over to open heart surgery, into the surgical, purely surgical. So, like what he has asked for orthopedics, orthopedics also needs to cover amount to get people.
Yeah, that's right.
Or maybe not get the chip plates or something, so they should also check out. So, but what we encourage, let them come. They are watching with those issues, so that again we'll have our data. To collect the information abantu bagendera tegocha. And again one more thing, with few medical camps, with association to the community.
Yes.
And then what I've seen, some parents say abantu bandi baboire koleta abanchu baba baruarite.
Yes.
Ese no mugakomino ruarite for a very long time. Batete komoreta nyagitari ubusoko. Omwana geso iboire obwate some abnormalities. Batete komoreta mutu aruariwe. You know, we have seen so many people even chain their kids at home. So we want to tell you in general or anybody that we are free to see anybody and we are free to advise. So abantu baito tigabache basoke bayigoke nkoro bache abanyagitari mbakaro babarigereri babakonye. Thank you.
All right, ndiyabona sana. Na into tolenta medical camp iganyamira samumabea. Baba nyamira na into tolenta medical camp nyamira.
Ngojere is part of the plan. Ya nyamira ngojere ngojitobate bitariki bwango iga. Lakini esa nkyo tikabaracha baruari usite bosongo teliare ko nyamira.
The next question is for all of you. Dr. Do you think this medical camp bridges the gap of health care access? If so, how? Medical camp but you know from where you sit. You know watching at this medical camp, you bridge the gap where I say accessibility and health care servant the Bible. If yes, how?
Okay, a medical camp in Nyamira never planned for 27th of June.
Yes.
they are bridging the gap now they have antu bali bagoje batari goje nyagitari ko batakuwa tibesa igo anke mambi they'll be assisted baro batamaidi go sembaru warite ono bagoje otoka na bagwa to yeregete that is already bridging yes so screening you health education ko so yamande go ya health so that is bridging the gap amewa kon it assists the daily treatment
I know from where you sit, you know, pharmacy, yes, consultant, yes. Say you will be giving medication 1 times 3, 10 times 1, then you will give that knowledge.
Thank you, sir. We will give the knowledge.
Yeah.
We'll ask the patients given instructions Mariogo for how long. Again, on that same issue,
yes,
we request that all patients warenka na Mariogo wasiache nyumbani.
Okay.
Norwata Marioga kwa tunaro iga atare naro. In case the pressure or the sugars are not going down,
yes,
our physicians will be there. So it could be easy wachenchiri ogoriri gesabata alternate to another drug yesettlement dose is to reduce.
Okay.
Kindly talk about request bali babwate na marioga abo yabekine bagi risakara bekego time abeke bagi me achinaro tocho tobasome na marioga gotemeka na kyabwane te gotemeka in case yakere ibiri ryogo kuni.
Okay.
Na kyabwane te gokora.
Okay.
In case obiro nyura marioga birwe ntukomyerimo na kyabwane te gokora. And back to the issue of breaching the gap,
yeah,
already a medical camp where we have breached the gap because the gap where people now will be freely towards. Ignore this issue, ticket number, go to Windows something or need get so doctor you got what they call what they see so cheated theater. Now they love him live. Teri necessarily senoru walete nini nchuro ranya nyomo nyagitari doctor igara mokwani tumyagitari mbiyole na kurukuigara kware nayo kurukuigara nayo kuruku doctor ngeri nayo kuruku doctor imeke you know those names that you have heard and you have longed to see them just come and say biyande na takanda royo na doctor igara na muibura matuka mange biyamona. Again, on breaching the gap, you don't need to be sick. Maybe ngo achite nyagitari yo igara yesengo achite general tugakonya. Just come over and say thank you mwa nkonyete na acho kuboira ndimbya mono na koreki. Yes. Na bweni rembu yangenderete.
Yes. And by the way, ntwakora a summary. Tumanya nguchomule tutakumanya feelings jabantu gwarango we got all challenges that some other bara organize this free medical camps, but this one is big. Tumanya what are some of the challenges they face. What do you think people fear even going to this free medical camp? I can highlight the comments fear of reality. No more agreement go up but there's some reason to go around a badger. Whatever, and clean to the fear of reality. Some guys don't like negative part of reality. On the other hand, again, don't taking Tamanya, or you did a comment in Tagan. You the fear of old what ya children, what but the ya children, Namo or a pimonyo what a lot of diseases na end. More than a bime pressure, a tele and we are only what to be done. In only what to go home. Student in what to go home. Now what to our tackle stress. I wonder what the fear of not having money. I want to free medical come mommy, Pimu, my organ condition and they don't have money. We have not have a stress in as a woman mapema hata kabla ya ile ugonjwa yenye imepatikana nayo. So you see, watu hawataka stress ya kuambiwa uko na ugonjwa more than 10. Not even a mocha mtu wati umenya solve what 85 diseases. You discover you have 85 diseases. So you see, these are some of the challenges that we have. And if you look at them, they're valid anyway. But now, despite all these fears and anxiety and lack of money,
okay, I hear them. I feel what they are feeling.
Yes.
Number one, I want to know what a terminal illness, was about the HIV, was about the cancer. Like in one of really. There are Amarioganaro, on HIV, Amarioganaro, there are 90 years. But the cancer, I don't go where to mapema, go where.
Yes.
A killer, the Yaman to buy which are late, but which are stage 4 in. You go living to Caro work or screening, or I won't go up on mapema, or our and the wait. You didn't work on you. And the Yakabana, I want to borrow. I was here to go over. Every maybe I got with a diagnosis Etaya. And John Adiago confirm was no mind that ever do. Was nobody more. And after now, and our own go body. And then I believe in get a will see, was around the guy, Lamont to Taricobar. About to know Wacobar, no 100 years, Wacobar. Is he or she strong enough? And be a work and be a work. Only be very strong enough. I would take a machine and have okay. A name Korea, ego Koregas. Go one to Mao, one and Tabaco, 2 Valente guitar, Takumatia, no, to Moira again, never bad no more. Nale moyo mulenda ruali no mo ibodio nero ko ibodio
stress. I'm happy that talk about our psychiatrists, doctors will be there, so they will actually explain you. It's more stressful not to know what is going on, just keeping quiet. So stress now lowers down. Lack of knowledge have destroyed my people. That is Hosea 4:6. So if you go through that process,
yes,
my friend, you'll be more or less stressful than just you hide. You know, like you might take once in a Korea. Either what the TB gets HIV. Then now you don't want to come forward because of the reality to know, but what come fearing on. You know, you get now pressure comes up, sugars comes up. So it's better.
You develop even more
conditions.
So
it's better. Come in, check out. We have now good machines for checking out TB. We have even self-test kits for HIV/AIDS, self-test kit for sugars, pressure, and all that. So that is the first disease you want to go.
All right. Because we asked a question on the topic. Ukilemewa zaidi na uambiwe sasa kitu yenye imekulemea ndio hii, bado hiyo ni reality. So wanjira ni reality.
Yes.
Mapema lakini yabako ila this comes and but baba addressing abantu bangi muluta kama zinyaritaya because of ABCD itukulianjo ina amangi tomorrow at Kisii University utaona daktari Wigara, utaona daktari Ratemo, utaona daktari Medcare rafiki yangu, utaona madaktari wote, utaona watu wa SHA, utaona watu wa damu na tumwenda mungu sikuwa manyinga akana tukubete daktari kwa wata manyinga mangaro utwana mangi access for you are healthy. Awego. Eternity. Now for
na bara kurwali and then depending on eternity. Okay, manning one karto kwana igora manning atote go cells.
Yes.
Red blood cells or white blood cells. So the cancer never atwali kolenda mototwara blood cells nyingi. Igo na ora te lakini baro nanda ko ba healthy ba watara manning baro. Imbaro ba healthy tongero ko HB when was 18, the normal is 11 to something 14. That one is still normal. Evan dombaro very healthy go and na maigu the blood donation nero ne karo te wan barwa manning. That's what donate ya manning o donate na ko konya bantu igo very healthy.
All right. Thank you very much. Much very nice. So we are running with very few minutes to wind up. Ndo sikia nice kwenye mwata liborio. Lakini we hope ungamambia kwa romo nene waba Kenya, waba ndukurusi na the surrounding counties mbata ya mbaligo chewa. Hautakuja kusema nano wakufukuzi hawezi fanya namna hiyo. Hiyo watakwambia nano kalia hapa. Igo muo wamota ngi they are here okonya obulima bw'abantu okonyo manyengi kiwukuli odaro chire opimiro da bukende ngeyo partner bayibote ngana arwalete isema because you are an expert okwera sabuyanga daktari inko iwero on my upper right ento yekumbetera na ndo mende barabu the more you explaining the more banyole lichibedeka unokora kweresa obanyire kiyekulite you imagine yani unaigana problem yani nimpone kwa sababu unajua tu shida ya mtu kaenda atakueleza tena sawa kwa nini nataka endelee kwa menta matuko Nancy Kerimo Magoli wa live from Australia ndema sana Dan Kanombano Nchiri I want to enjoying the show kwa tusemcha nyamache kumagacho basi enjoying the program so much ndema sana for the feedbacks kwa ndio tutumela chinyinge kwa kia ngatuko pamoja ase emambia bono leo kwa Evelyn Corona Rock awata nimba wata tewana mitutri online kwa na Dr. Weigara I met him long time ago but hawezi kunijua daktari wala betakumanya otebire kwa na daktari ratemu mama iga mange na ndenya saba sina singia nindote Jona urachisa mwachia ugembo awata my sister Sarah by the daktari come from ugembo ana antubanga wana bandigirete that's very nice bia mwana kwani mwako Ontita gendima kwa maragabo awata nga asalimia madaktari wetu very sensitive and educative session sa tokonye abantu mwambie sokie mnyoro bulingulia wabosa na mwewe direction bia mwana sana Maria Ugao na tutukura Samita Junction au tabanga very nice discussion at TV. Asante sana. Salimia wageni wetu wa nguvu ndani ya studio. Bia mono sana. Nawe igo tevira kwa Leonida utanga daktari Weigara. Unakaa sehemu gani? Daktari Ratemu, good morning. Daktari Weigara na sasa mkiona kwa sehemu nyingi.
Penye nakaa kikazi okay nafundisha Kisii University
yes.
Nafanya kazi Kisii County Referral Hospital kwa sababu ya MOU tuko nayo na Kisii Council nafanya kazi huko pia operations plus private hospitals na niko na ofisi yangu Kisii Galaxy Medical Center hiyo iko opposite Quickmart
I think yata kumanya so nabara korobo regitare akiwa karibu nyitale na kora koro akumia kitari this is how they work the private hospitals and medical services. I don't know who so long as you the services. Pia mono sana kero toka endete daktari talk of who are you partnering with to this noble cause. We need to recognize them and of course tomanye parabia babo ko ligasikera barabo especially for tomorrow's event.
The biggest partner to what, of course, now the Inca Medical Association, of which we are both of us are members, and the what, of course, Kisii County government through KTRH and the other doctors who work and nurses who work within the county. The what Avenue Bakarari, Chistan Javo, Red Cross, the what the partners were awange wa donetri Madiogo and other donations. Chibank Chiatokonyre, Stima Sako, Waumini, Chibank Jones Chirevosongo, Equity Afia, Igona, alafu Nchigitari, Chirevosongo, Amanda Barovago, Chanamarocho, Java Hema Hospital, Galaxy Ito, and other hospitals. So partners now, now, of course, go kwa Kisi Eye Hospital, because the Innovation Eye Center to be screening the Magana Eye Services. You go partners now, Wangi, the convention once, other is Nashukuru, the partnership.
That's very nice. We need to recognize them. This is not a usual course. These are very different course. With all the partnership, I want to watch it now, but I know that's very good of you. And tell me talk about Mario. Mario, I am also going to say, as a result of the partnership, I was going to the flag, just make
thank you. Sarah, we have partners who have volunteered themselves to give us drugs, like the likes of Dr. Tundo, who has this Phoenix Pharmaceuticals in Nairobi.
Yes.
In terms of production ya Mario, then we have the pharmacies around the town, very willing also to support us through free drugs and all that. What I assure people is I'm just part of a team Tokoroka Pharmacovigilance.
Okay. Pharmacovigilance. Okay.
So pharmacovigilance, our main duty is to ensure the safety of the drug.
Okay.
Unanielewa? So that in terms of theft or in terms of what? In terms of usage and in terms of the quality. Marioga original.
Tawa fake.
Tawa fake. That's the right word. Tawa fake. And what I've ensured is for the last 13 years experience in pharmacy.
Yeah.
In KTRH, the lab, which is worth 1 million.
Okay.
A mini lab for just drugs. I can carry that mean like a briefcase and then check it. We have also gone through the parts of educative. I can easily detect the way labeling and all that is done. And we have also ensured that all our pharmacies were very aware Amarioga fake in the market.
Yes.
We keep on pulling drugs every now and then. That you get a badge, get a number, get a more so we have also ensured that the medication that will be at the camp, our safety team from our vigilance team will also be there to have a look at them and again to talk encourage our yes. Sometimes don't carry too much drugs home. Drugs are dangerous. Drugs are very poisonous.
What do you mean? You don't carry many drugs?
What I mean, oh, nothing in Joe, Netira, Buyande, Panado Panado has killed people, liver cirrhosis. Then, Abande Manjata and Uncle and I was septri. Now you can cover Kambatira Kamiri, and you wait a Kuruare, now is septri 9. Like currently, we have a case of SJS. Steven Johnson syndrome. Eliogere ke kwali nyure rise ko react no mubiro kuyumugima. Kwanya ko rumuntu sambiroro geseni ni yes na accident yabo geseni egari petrol ya tekasa abantu na bakuyi. That's how that drug does your whole body. it's something that you're not supposed to joke with drugs. Na kyo te will let an expert give you drug. To bose ko mo kabono. Mwana olinkolirare na tu Dr. Igara nangete septini nige gankorwa rige kuba mwaga ntetera ko gankonyire. You might end up killing the kid.
Wow.
So sometimes like tota baba very cautious. Allow us to teach you, allow us to give you knowledge on which drugs you're supposed to use.
Wow, that's very scary. Yes, that's very, and that's what we do.
That's you said we'll have part of it, you'll have more elaborate and even show you pictures on what will happen.
Yeah.
But Amariogo, me as an expert, I also encourage people, be cautious, take medication as instructed.
By the
as instructed. Tubose wikote bono nanyweta matukabere nkabwena natiganya mulyogayo. Mambi yaye umusani ogo gesondo rwarire mutebyo matinge nchukuigwa njina bo Dr. Igara Dr. Ngeri mekya ngete ryogerio kabwena kwa decide na yako koreki na nchuchu na yekanyi.
All right.
It can kill you.
Thank you. We will have you soon. Tell you adding something.
Kwa mboligo ya partners the other but what Gawande siko.
Oh yeah.
The partners almost andi korokine university iturende to anchire.
Yes.
But we have about 26 partners.
Wow.
Equity Afya, KCI Hospital, Kenya Red Cross Society, Sai Pharmaceuticals, Mario Tamaniogo, Regol Pharmaceuticals, Sphinx Pharmaceuticals, Mayos Pharmacy, Jack's Pharmacy, Jimia Kenya Limited, Dawa Life Sciences, Avenue Hospital, Silver Care Medical Center, Area Limwembe, Path Care Hospital, Dynapath Laboratories, Inca Medics, of course, Shivling Supermarket, Beyond Zero. By the Beyond Zero, clinic, first lady, Beyond Zero, Nairo services, screening, no Family Bank, Stanbic Bank, Stima Sako, Kusimu Alimu Sako, Egerton Sako, International Solidarity Foundation, ISF, Mwalimu National Sako, Robbie Water Company, na Fairmount International School.
Yeah. How did you get all those people
Those are friends. Good friends.
No, those are good friends. We are good people at this university. It is a big institution, and people also want to give back to society, wherever they are.
So let's understand it this way. From you. The one who have a modern supermarket, Stima Sacco, Family Bank. If I know what I know, advantage by going to need account.
Not really doing the marketing, just standing out for opening accounts. I want to support the camp. To support the camp. Maybe make a real logo. I always say banner, then people will remember that. Yeah, I can't remember what just stand the account. From there and logo na mukayera. Until you get the confirmation from your experts. Daktari Oigara abantu baitumuto watetia abantu but nashukuru sana ebyomanya n'abantu batagete kumanya igoro yafe cyabo irigiri bidike bache then what they think of Daktari Oigara ninje pali ngo jana record ati no daktari ya galaxy speaker ansisi kero comfortable ali ukwanira abantu bya ngo wirigetiga endoscopy yo Ojo tobaro kichi machine
kabisa so abantu bamanye bati mutraro ukwana ne scan okuminga what is that ukwana marae ukwana gosengi mtu ajui abacho koyibera leka nomorero ya tabunga muntu natakire kwa scan what is even that? Ngone ngepindi ikiwe kwa tunainchi sana ya Ontita njimba tena kitoto mjinji going forward. Daktari, what are some of the challenges you encounter, you as planners of the event, as the experts? What are some of them more encounter, and how do you fight them back so that it doesn't hinder your services?
Thank you for the question.
Yes.
Nyombati tanya kuburu nyonye chumbi.
That is it.
So most of the challenges, maybe I can talk from the pharmaceutical side. Sometimes we might have some drugs which have been donated to us, and we might restrict giving to patients unless and otherwise further instructions have been given from the doctor who has prescribed the drug, which now becomes again another challenge. Another challenge again, we might sometimes run short of supplies, which might be a disappointment to latecomers. To latecomers, which we also work out and see how we can help them. The main challenge that our pharmacy team will have is sometimes how we issue those drugs. Sometimes we might restrict somebody who has sugars, not giving a drug for a whole month. So maybe we'll give you for like a week. Some might feel disappointed, but sometimes it's give in and take. At least kero montaño reliogo, munari kero reliogo, achire nyumba. Yes.
All right. From that point of view, from where you sit and from the whole event, no more organized Tiga, that's a very cheap.
Oh yes.
Yeah. What did you encounter? And then I give more negative success up to where you've reached, and we hope that it will be a whole success even tomorrow.
Organizing this event is not easy. First of all, you got the blessing of the university management.
Yes.
To work on Biamano charity, and the university council.
Yes.
I'm now about the university. So I got one permission here. You. That doesn't come in easy. We can more economies number able.
Yes.
To hold the university manager spend some money to feed the doctors that day, to get the tents.
Yes.
Even supplies, get the equipment. We don't need okay. Permission from the county, from the security, from the county director of health. You go, if the living go up in the background, it's not easy to go hold the medical camp.
Okay.
It is you can say some capital intensive kidogo, lakini then no kuerua ili ndio tutakonya wananchi, and you have to push.
You must finish what you started. What happened on the background.
Yes.
You must show people that this thing is achievable.
Exactly.
Exactly. But just push, continue pushing. Asante sana mwaligerere ko base kinyozi yeko Salim kinyozi kera igama ya yetu kene nayo konya ya quick mat ya imaigaya ontabiri salimia Dr. Igara salimia na Daktari Ratemo, watching and listening keenly. Thank you so much Salim. Ojo desha bikiretu kabisa and tule timu ya Arsenal. Daktari Ratemo na mwana rajito mbira then of the day got the yule timu yosha bikia anya Daktari Igara. Tiga wana kana gensa.
Njeno Arsenal.
Wakele hapa sasa. Mwana Arsenal. Wewe ni timu gani?
Arsenal.
Robert Kongo itatoro monto.
Niliambia mtu nini? Alafu na Salim ni mwana Arsenal. So, hatuwezi kuambia
mwana Shabana.
Achana na watu wa Arsenal. Leo jioni tutawanyorosha kweli.
Ni Arsenal na Shabana.
Arsenal?
Shabana.
Na Arsenal?
Shabana kawaida.
Achana na FC Leopards. Ndio Shabana. So tuko sawa. Daktari, we only have 5 minutes. How do you see the future of this medical campus in terms of technology and in terms of community impact in the near future? Because come next year, a time like this, we'll change technology and everything, and you have to this medical campus to trigger.
in terms of technology, they're going to be even more sophisticated. One of some digital, one of them in the registration to computer. Next time it will be computers, carry station to computer package of that is number one. You know, the water daycare surgeries, a pinhole camera interviewing nigga. It will be done on the same day. Just scan it, mobile. You have your scanning there, your X-ray, your X-ray is there, and then so things are going to become better. Even though you have a mini hospital getting to Gamma the whole day within one day. Yeah.
Now with the technology as it comes, even mobile services have come easily. So what I feel, each and everybody should have at least once or twice a year doing a full body checkup. Full body checkup. Somebody asked my friend here, I mean, Lisa asked Dr. Igara, with these multiple disciplinary, with these many doctors, nurses, clinic officers, pharmacists, farm techs, how do you mingle? Do you guys know one another? Do you guys have a social life? He mentioned outside the bar, so not most of us go to the bar. What I mean, if technology now keeps on improving, next time you can do checkup in your house, and maybe to show you have a problem with your chest, you have a problem with your stomach, and it can even direct you the list of consultants who can do what, who can check out you have ortho and all that.
All right. Yes. We are saying the producer and just shout out that I want to call full body checkup. I want the record kwenda iko kwenda Sam usiona ngorwanye ne kwani wewe kana sipepewe igara ngenda sidaktari fulani usengo kwa combined full body checkup.
Okogenda Samo a comprehensive clinic. Most of these clinics is in town here. No, they to what the galaxy. The best in Chico signify so they can be done within a day, and we're gonna go and Samo. We're gonna go around. Yeah, you got already then I was a refer as a car again to get sign get.
Just a blood check.
Full body checkup from head to toe.
To toe, everything. You go to this don't check you, but beyond, you pay for that service. You want to go to full body checkup free in a hospital. You pay, of course. Yeah. It's very free. By the way, location in Kisi University. You have something?
Yes. Okay. I was just trying to, because of time, the issue of us socializing. We have various events, like now in the Kisi County, which we thank our leadership, health leadership, through our minister, chief officer, directors, Dr. Emeka also. We have what we call Afya Cup, which the governor supports a lot. So these are all workers, all health care workers, including Nyonye watchman, including Nyonye nurses and all. Everybody who works within the facility, accountants and all that. The hospital does not comprise of nurses, doctors, pharmacists. The what the chief secretary into what any. So we have we did have a football tournament this year February in Ngozi Stadium, which the governor was very supportive. So that made us socialize. And again, it was a weekday that we had our time off duty but on duty.
Yeah, off duty but
on duty, because we were not in our offices, but we were on the ground, but officially on duty.
Okay.
So it's a moment that also binds us together, makes us also less stressful, fun, know one another. The thing is connection.
That's very nice.
Connection. Yes.
Because you really need to meet up with other
from all facilities.
All facilities.
Yeah.
Yeah, my brother from Nyancha
Yes.
Is it level 4?
Level 4. It's level 4. Yes.
Now they will about that tournament. They will just
Mimi number 6.
Oh.
Just number 11.
And thank you so much. It was a pleasure having you. But you are one last parting shot, and
Yes, that's true.
So combine it as your final statement.
My final statement, kwanza wakambia mwana seta ati viko talentaga.
Yes.
Otevia wananchi gore ya kampe ya tomorrow. And yente kana amaroire yenda. Amaroire yenda na ro mono go specialize. Wananchi tika manyina gore bonsi wenda tali alsa. Yenda tali alsa. Amaroire na manga yenda almost 50. Iko tega baji bapimo takorwale kuchialsa lioka na myaka ebere iko tari alsa incho pimo na vera benegende kyao cancer na bego present na alsa na ukore mu rwasa meya pancreatitis na bego present na alsa iko tari kerendo kerenda ke kurwasa ina iko mono ego chanda abantu alafu marwe na ra kuruna marwe ya mabere paka kwate to ngombe na none ngori tego kuna aturi nyama to mabere obuno bolimo ama ya mwana mabere paka mabere na rakoreta Brussels wasino bochafu onyama papokoto liwa konka more direct bari konyara Brussels ono kwa magonya ntana bate marira mabere igo lande no tuara mabere ngori itiro wokunengo ambetari bo kodi nyama tari bo otherwise even though they being tara kwana de ama bate maza to
I thank Etaya TV for this opportunity. And I urge the whole community, the Kenyan community, as Omogusi, medics with our colleagues, we are ready for you tomorrow. Mukaribie kesho mapema, muike mapema, tokonya ngora mubaba toereru, turi ready go serve kero muntu.
Thank you very much. Mimi nilani niongeze ama nitoe. But nitaongeza. Tell you wetu ngaraiti from where I sit from a media perspective and uyano bonge bororo. Elekeka robacha mba monyera ngasa hata usikose kesho. Njoo. Ngenda njoo tell a friend to tell a friend to tell a friend baganto baito limambia egera barubaro the sense of having this thing next time around. Mwochaba ke watasema watu sio wagonjwa. So haina haja. Ukikuja wengi they will force them but walechi many medical camps waiki Nyamira County wacha go and beyond ikiagera their role no corona bantu. We have a very healthy society. Linia garuchi to ronga yoro ni chweso no iko bata dawantu bamenye free of diseases and then tuarwa sekazeti ya tebanga amorena related to chest malaria na skin diseases actually cover on the rise. Ayonsi mochimoboli mami because our time is up. Daktari Donald Ratem, thank you very much.
Welcome.
Daktari Oigara, thank you very much. Raymond. Yeah, thank you very much. Mongora Daktari Oimeke Marita, the CEO, KTRH, Omega Mange. Mongora Department ya ENT, Nekadari Kovinyakundi, Omega Mange. Koro Physiotherapy Ali Maximilian, Omega Mange. Ward 10, Roger Sumia, Omega Mange. Amange sana, KTRH, Omega Mange. Pia mono sana, Yasaba Konye. Whatever you're doing is a good cause.
Thank you very much.
Wacha mliele tutakona wasibona watamiza tutakona ina nainde Jumaine moja but na bata vinga ninche mbali kibono on my ground asa mangana yumo rulipo chenu wetu toleka na kitoko nyabantu wetu because kirenga TV noko manyabantu ko basemya na ko ba Wokia. At this point, you go to Alcobasemia, Nakobamania. The Tokona was one of an Bryson Makori, Wakanambiamono, Naya Morgeria, Watatomere, your feedbacks. We are very proud. Thank you so much. Joshua Uta, for Sensory Transmission, Chingaki Franklin Mayunga, Arenge Asensemo Yichi Camera. When you buy a ministry of a channel, I get a breakfast show, Jimbo Wazir, Sarah Ontita, whatever Nadora Chingia, Saudi.
Yeah.